Hello guys, welcome to Medico. Today I'm going to explain you about back muscles. So we have three types of back muscle: superficial, intermediate, and deep group. But in this part, I only want to explain you about superficial and intermediate. Superficial group consists of muscles involved in movement of the upper limb. An intermediate group consists of muscles attached to the ribs and have respiratory function. Sometimes we call them appendicular group because these muscles are involved with movement of this part. They attach the appendicular skeleton, which are clavicle, scapula, and humerus, to axial skeleton, which are skull, ribs, and vertebral column. So in the superficial muscle, we have five type of muscle. The most superficial one is trapezius, uh, then Latissimus dorsi, Levator scapula, Rhomboid major, and Rhomboid minor. So first one is trapezius, is a flat triangular muscle here situated along the vertebral column and goes to the tip of the shoulder. Okay, this is the trapezius muscle. When both of them are together, we call them trapezoid muscles. They originate from superior nuchal line and ligamentum nucha and spinous process of the C7 to T12. And their insertion is lateral 1/3 of the clavicle, as you can see here, and the spine of the scapula here. So their function is assisting in rotating the scapula during the abduction of humerus and elevating the scapula and depressing it. So this is how it depresses the scapula. This is the way how it adducts the scapula when you bring your shoulder backward. And this is the upward rotation movement. So the next muscle is Latissimus dorsi. It's a flat triangular muscle, originate from lower portion of the back here and attached to the humerus anteriorly. This is the Latissimus dorsi muscle. It originates from T7 to L5 and sacrum and iliac crest, and also from rib 10 to 12. And it attached to the floor of the intertubercular sulcus of humerus. And the function is extend, adduct, and medially rotate the humerus. This is the extension movement of shoulder. This is medially rotation of the shoulder. And this is the adduction of the shoulder. The next muscle is levator scapula. It comes from transfer process of the cervical vertebra to upper portion of scapula. This is the levator scapula muscle. I removed these muscle here because we have a lot of muscle in order to show you with better view. It originates from C1 to C4 and it insert to upper portion medial border of scapula here, and its function is elevating the scapula. And the next two muscles are rhomboid major and rhomboid minor. The rhomboid minor is superior to rhomboid major, comes from ligamentum nucha, and rhomboid major come from spinous process of upper thoracic here. This is the rhomboid major muscle. It comes from spinous process of T2 to T5 here, and it inserts to medial border of scapula between spine and inferior angle here. And its function is adduction and elevation of scapula. The next one is rhomboid minor, which is superior to rhomboid major. It comes from lower portion of ligamentum nucha, a spinous process of C7 and T1, and it insert to medial border of scapula at the spine of scapula here. The function of rhomboid minor is adducting and elevating the scapula exactly like rhomboid major. They have the same function. So those superficial muscle is finished, and we're going to uh, look at two intermediate muscle in the back, which one of them is serratus posterior superior and serratus posterior inferior. It's easy to remember because the name is exactly the location of the muscle. It's in the posterior side, and superior one is the upper side one, and this is the inferior one. They pass from vertebra to attach to ribs for respiratory function, and that's why they refer to respiratory groups muscle. These two are serratus muscles. This is the serratus posterior superior. It originates from lower portion of the ligamentum nocha, spinous process of C7 to T3, and they insert here to upper border of rib 2 to 5, just lateral to their angles. And this is serratus posterior inferior. It originates from spinous process of T11 to L3, and it inserts to lower border of the rib 9 to 12, just lateral to their angles. Okay guys, that's all for first part. The dip muscles will be explained to you in second part. I hope you enjoy it. Please like and subscribe. See you next time.